There are a number of qualities that are associated with mindfulness. These include something called beginner's mind. What beginner's mind is the ability to come into a situation that's very familiar, like I do many times a day, walking into a patient's room, but coming into that with an open sense of, this is the first time I've come into the room. It is true, it actually is the first time that day, in that very moment, that I'm encountering that particular situation. But because the room's familiar, because the patients may be familiar, we sometimes tend to feel it's the same old thing over and over again. And that's where we get into difficulty. So can we approach this moment with a beginner's mind, with a sense of that it has never happened before? This is a very helpful, somewhat related to curiosity that we were talking about earlier. Acceptance, I mentioned, this sense of being with things as they are. One of my mindfulness teachers who had many years of meditation practice, a very skilled teacher, said, I finally got to the point in my life where, after all these years of meditation and teaching mindfulness, I can be with things as they are, as long as they're the way I want them to be. And that is true, you know, being aware that we want things a certain way, but it isn't always that way. Another quality of mindfulness has to do with sort of letting go of the attachment to have it a certain way, somewhat related to the prior point. Non-striving, this is a very difficult thing, especially in healthcare, where we are striving to make changes in a positive direction for our patients, for patients to make the changes themselves. But non-striving really asks us to not be attached to the outcome so much. We would like a positive outcome, but much of it is not in our control. And in fact, if you look at what physicians find most meaningful in their practices, it's not so much the therapeutic triumphs and the technology that they've brought to bear to fix a problem. It's those situations in which they were very present with their patients. And some of those situations are in the worst of circumstances, suffering, death, end-of-life issues.